My name is Robert Miller, and I'm the Vice President of Company Development for ComfortCare Homes. It's important to provide support to the family as much as we may be providing services to the resident. We're there to care for the resident and meet their needs. But oftentimes the family's amount of stress and need is not addressed in the same way. So once a resident is placed, it's easy to forget that the family's still out there dealing with the disease, and so we want to make sure we're addressing that. A family needs so many things at moments like this, but in particular emotional support. They need to understand the trajectory of the disease and what to expect with it. And they need resources in order to stay engaged with their loved one when their loved one's needs and abilities start to change. Guilt is a common emotion we deal with families, especially when it comes to the admission. But we often find that residents acclimate better than we might expect, especially if we've done our job right in collecting information to make the admission as smooth as possible. As a part of the admission process, how we continue to follow up with families is as important as the first step when we move in. So we follow up often that evening once the person has admitted so that they feel comfortable with what's happening, as well as ongoing through the weeks and the months afterwards, depending on the needs of the family. This can be as simple as sitting down and having a cup of coffee just to assure them that their needs are being met, let them talk through their feelings, as well as coordinating visits and being a part of the process of keeping them connected to their loved one. If there's one thing I can say after all these years of experience, ask for help sooner. So many of the families that come to us and face the fear of placement or making a change for their loved one realize at the end they should have done it sooner.